welcome back to the show.
Tired.
I know I couldn't even put the jacket back on. I need like a spray bottle, you know, just to wash the sweat off. Well, now that we've done our workout, we need to know what we should be eating. And one of the two things we're going to be talking about in this next segment is gluten and soy. And for many people, gluten is a big sensitivity, so we're going to start with that. We're joined by Dr. Nathalie Beauchamp. Welcome back. It's great to have you here.
I always get to have you after your workout, so you're all pumped. The blood's going to the brain.
Yeah, and my posture's a little better than normal. Whenever you come on the show, I always try to sit up a little straighter, except I know one shoulder is lower than the other. You've taught me that. Let's talk about gluten. What exactly is gluten?
Well, basically, gluten is a part of a protein in the grains, and what happens is that a lot of people are sensitive to it. So I think what we need to start with is explaining the difference between gluten sensitivity and celiac disease.
Okay.
Because a lot of time my patient come in and they say, I went for the celiac disease test and I'm not allergic to gluten. Then I say, you might not be allergic to gluten, but you might have some sensitivity. Celiac disease is an autoimmune disease. That means your body, your immune system is basically reacting and creating an immune dysfunction.
Okay.
Sensitivity is just your body reacting to it. And celiac disease, it's about 1% of the population, but gluten sensitivity, 85%.
Oh my
85?
Yeah,
really?
it's amazing, eh? It's amazing.
So, okay, the reactions you would have from allergic and reactions you would have from sensitivity, are they different?
Well, one's going to be much more extreme than the other. The people with celiac disease are really, really sick if they do eat the gluten. So, you know, like I said, gluten is a grain protein used in food processing because it binds, stabilizes, and prevent crumbling. So it's present in a lot of stuff. I don't know if you looked at eating gluten-free, but it can be a bit challenging.
So it's not naturally produced in the grain itself. We're adding it? Is that right?
No, it's in the grain.
Okay, it is already.
And
okay,
the portion called gliadin, and the people with celiac disease are sensitive to that.
Okay. All right.
So the first thing, I think, to answer your question, TL, is how would you know bloating, tired, especially after you eat? A lot of people, you know, immediately after they eat, their stomach is upset and so forth. So what I strongly suggest to people is to do a 2 months desensitivity diet. Okay. And why 2 months? Because it takes at least a month for your bowels to decrease the inflammation, and then another month for your bowels to heal. And I mean, the true gluten-free diets are done for a year.
Wow.
Okay? Not to say that you can't reintroduce some of those things down the road, but you really want to let your bowels heal.
But that's good to hear that if they can heal, though. Like it's good to hear that if you've done damage, that your intestine will repair itself then.
Exactly. One thing that I do get often from my patients that are now eating gluten-free, they feel so much better that they want to keep eating a gluten-free diet.
Yeah, it really drags you down, doesn't it? That's one of the biggest parts of being sensitive.
So I think gluten sensitivity is very much overlooked, and as soon as I start talking with patients about, you know, them feeling tired and sluggish and so forth, why not you try to do that? And it has become a lot easier to do. Stores are well, it's not easy. It's not easy, but it's easier. So grains to avoid are the wheat starches, wheat bran, wheat germ, barley, and then rye. And then the ones.
So beer's out.
Yes, indeed.
Okay, you can never do it, my friend.
No, I can't. I'm just kidding.
And then the foods that are allowed, amaranth, arrowroot, buckwheat. I mean, there's a fair list.
Yeah, absolutely.
You just have to be a little bit more creative with your food. But like I've seen so many patients' life transform going on a gluten-free diet that it was worth the effort, and they felt so much better after.
And you're seeing more and more recipe books going gluten-free as well.
Yeah.
So it's not like you're going to lose flavor and enjoyment of food anymore.
Exactly. Right? And then here on the next slide, obviously me being the chiropractor and the nervous system, that's often an area that's overlooked when people have gastrointestinal problems, is to look at the low back, because you know, the nervous system is the master system, and if the signals are not sent properly to the bowels, the small bowels and the colon, it's not going to do what it's supposed to do, and then you're not also going to absorb your food properly. So these are very important things. So, I mean, a recommendation with this is if you're eating, you're feeling sluggish, and you're really have a lot of GI upset, you really want to look into this.
So you don't. So you don't only want to look. Does it contain gluten? You want to see if it has wheat, if it has rye, if it has all of those things.
Yeah.
It will contain already gluten.
Exactly, but now they're really good at saying gluten-free.
Okay.
But one thing I must say is that
There's always a
chocolate.
catch.
No, well, it's just a box of chocolate cookie might be gluten-free, but it's still not that great for you, right?
Right.
Yeah,
So
sure.
people sometimes, oh, it's gluten-free, great, but look at the nutrition.
Yeah.
the
Yeah, still
nutritious
make
value.
smart,
Yeah.
healthy eating choices,
Yeah.
correct?
One of the allowed foods I saw on your list was soy, so that brings us into the next one, because I think people think, oh, okay, I want to go dairy-free, I want to go gluten-free, I'm going to have the soy, but sometimes soy can be a
That's
huge...
my next question. So what I did, guys, is I picked 10 true or false questions. So let's go through it, okay?
All right,
Sure.
let's do it.
So how well do you know your soy facts? Soy is a healthy alternative to milk product. True
Well,
or false?
I'm going to say false.
I would say true, because but it depends if people like if they're sensitive to dairy or not, right?
Yes, but the answer here is false because soybeans contain large amount of natural toxin called anti-nutrients. And the enzyme decreases the digestion of the protein from the trypsin. So the answer is false to that.
Okay. Hey.
Good job.
Next one. Fermented soy products are healthier for our bodies than non-fermented. And I'll elaborate a little bit on that.
I'm going to say
or false?
true.
True. Fermented soy products decrease the amount of anti-nutrient, the ones I was talking about, present in food. And fermented soy also produces vitamin K, which is important for bone health.
So
Okay?
what would be an example of a fermented?
I knew you were going to ask that. So that's my next one. Is tofu a fermented soy product?
False.
I'm going to say false too.
Okay.
Yeah.
While it's true that tofu is